My name is Elizabeth Hernandez, but I'm known as Lisa. My journey was a complicated case, which included that I could lose my leg. Immediately, when the referral was made, I was lucky enough to meet Dr. Pepard, who is the medical director of the unit. He came to see me, and immediately he started with a very extensive physical assessment, and all as a way to ensure that they made a plan that was unique to my recovery.
So Elizabeth Hernandez, she has had problems with her knees for many years, underwent knee replacement surgery, which initially went well, but she subsequently had a fall and fractured the knee replacements, and this was complicated by an infection later on, so she had multiple surgeries. So the time we had her was after she underwent a revision of an infected knee. And even so, after the surgery, the wound took a long time to heal, and it was complicated by chronic swelling she has in her legs called lymphedema. But she did marvelously well. She was an orthopedic case, but she did fantastically well.
As an inpatient, their whole philosophy, I guess, for lack of a better word, was to look at the individual. I was just not a left knee replacement. I was a person who worked, who wanted to go back to work. They looked at my ability to drive, so I practiced on getting in and out of a car. It was very challenging, but I was lucky because the nurses were always ensuring that they met my pain needs while I was admitted. So I'm grateful to say that I thank the inpatient department because my leg is fine. It would have been a much different life if I did not come, because the risk of having an amputation and the fear of that and dealing with a life was very different. I can honestly say now I'm back to the activities that I did prior to having the surgery. I'm much more engaged in my activities with my family, and it's all thanks to the rehab department who allowed me and gave me the skills and tools that I need to continue my life as I know it today.
I was able to see Elizabeth today, and it was remarkable to see her with fully functional, no cane, no walker. She's very happy, and we're happy to have her here.